Cancer Television is here to discuss the European Multidisciplinary Cancer Congress. With me is Anita Waldman of Myeloma Euronet. Also Galinda Boda, you're concerned with ECCO. Now that's about children with cancer. Kathy Oliver, you're here to tell us about the International Brain Tumour Alliance and how rare cancers can feature quite heavily. And Tom Hudson is our guest from all sorts of places, including Ireland. And Tom is here to discuss the way that men often get overlooked, but we're all talking about patients. I'd like to ask Galinda, specifically, you deal a lot with parents, don't you? How are they impacted by access or lack of access to cancer care, information about cancer care?
Well, information is the key word. It's very important to get all the information you need everywhere in the world. And within Europe, it's relatively okay already at this time for parents of children with cancer, because the pediatric scene is relatively well organized in that sense. But of course, parents need the newest information on all the treatment possibilities as soon as possible. And that's why such a congress is very important, for them to get information, and for not only for them, but also for the older patients. We also have patients that can talk for themselves, so teenage patients or young adult patients who also would be very interested in being part of a congress like this.
What are the big focuses of the Stockholm conference that you're interested in emphasizing?
Well, childhood cancer is a rare cancer within the whole perspective of all the cancers. So where are the specific new possibilities for children, for the treatment of children with cancer? And then within the whole scope of childhood cancer, you have so many rare diseases if you put them all or break them down into all the different diseases. So for each particular disease, there is a lot of necessity for information.
Kathy Oliver, can I ask you about how you feel about all of these things and what's happening in the Congress in Stockholm in the context of brain tumours? You're representing the Brain Tumour Alliance, relatively rare tumours, but still quite a lot of them when you add them all up together.
Yes, that's right, Peter. And actually, we have a session on rare cancers at the conference, at the Congress, and we have a range of patient advocacy speakers, of clinicians. It's a very mixed bag of speakers in our session, as in all the other sessions. And we were talking just a moment ago about the cooperation between clinicians and patient advocates, researchers, scientists, nurses, everybody. And that's one of the hallmarks, or we hope will be one of the hallmarks of this Congress, that there'll be a great deal of collaboration. Patient advocates who are attending will have free access to all the scientific sessions, to the exhibition, really have the free run of the Congress, which is excellent.
How open do you think clinicians are going to be to the idea of more consultation with advocacy groups?
Well, I think that clinicians are becoming much more open. That is the way that everything is going, and patients are very much at the center of what everybody is doing in the cancer community. So I think it's a tide that's going to be quite strong, that people will have to recognize that patients are at the center of everything involved with cancer.
It's an idealistic idea, but of course doctors will want to know what's the payoff, how much can they really improve their care, or is it better if the patients don't really know much about anything?
No, I don't think it is. That's my personal opinion. And I really do think that patient care will be greatly improved by greater collaboration. I think there's no question of that. I think trust will be higher between the professionals and the patients. And I think it's really very much a win-win situation to have greater collaboration. And following on the theme of information, we've allowed in the planning of the patient track plenty of time for questions, discussions. Yeah. We've spent actually already more than 6 months working on this Congress and trying to get all these elements together.
Tom Hudson, you're involved with the, I almost said sister organisation to Europa, Donna. It's called Europa Uomo.
The little brothers.
The little brothers, that's right, yes. Now tell us about Europa Uomo and why you think men need more of a voice, men who are talking about their experiences or their relations' experiences about cancer.
Well, I think men have traditionally seen themselves as being in control And when there's a health issue, it's quite difficult for the average man to perhaps accept that and to acknowledge that he has a problem. So that's one small step that has to be overcome. But I'd like to approach it from a partnership point of view. A patient or a man is working in partnership with his doctor because they are collectively, they're both trying to make him well. The patient has a very real role that he has to play, and he can only do this if he has really good information. And that information has to come from the doctor. So if you're well informed, you know how you can collaborate with this guy who is making you better.
Now there's access to information and there's access to treatments too.
Yeah,
you mentioned the internet, and what do you think are the barriers? First of all, Tom, what do you think are the barriers to getting the sort of access to treatment that you would like to see more of?
Well, if we're talking male and if we're talking prostate, because that's where Europa is coming from, there are quite a lot of choices. And men need to be informed of the choices. They need to be allowed to be part of that decision making. But you only get that from good information. So the good information or the lack of it can be a barrier. I mean, you might end up with a particular specialist who only specializes in a particular type of treatment. And so a man could be well denied other choices, which may be better for him. There's also another factor which can be quite critical, and that is that you do not need to treat a man over a certain age. His cancer might be there, it might be very rare for him, but with proper medication he can last. He does not have to go through maybe a life-changing or a quality of life-changing operation which could destroy his quality of life.
There is also the issue, is there not, that doctors are bombarded with information about how to use particular treatments, and they may become enthusiasts. So patients may be able to put some kind of break on this and say, hey, let's look at quality of life, let's look at the whole issue.
But we, if we can put we as patients, need to know that we can do that, and that is what advocacy is about, to enable people to take that step, because it is in our interest.
So
it's in all our interest.
In Stockholm there will be information, there will be explanations to doctors and to patients and their families on how to get the information that's needed. And in ECCO, the Organisation on Childhood and Teenage Cancers and Parents specifically, what are the things you're going to be revealing in Stockholm?
There is one issue that the pediatric oncologists are a little bit more advanced in setting up clinical trials that are encompassing a lot of different areas, and so this is a kind of a role model that will be discussed and shown.
So adult cancers have a lot to learn from childhood cancers.
They could, yes. Okay.
And also more to convince the young adults, because there's a big gap for understanding how necessary it is to be on treatment and to be compliant, for example. We learn this each day when we are in contact with younger cancer patients. So.
And Kathy Oliver, in rare tumours, what sort of barriers do you think you have encountered to access to information and to the right treatment so far?
These are very big issues for patients with rare cancers. There is a tremendous lack of information about the specific cancer types. We have difficulties with access to treatment. We don't have enough clinical trials, registries. We need more specialist nurses. We certainly need treatment by multidisciplinary teams. That's very, very important. You need to have clinicians who are familiar with a rare cancer. And actually, we have in Europe 2.7 million Europeans affected by a rare cancer. Not many people may be aware of that figure, but it is quite a large figure when taken all together. Rare cancers are not that rare.
So what will you be able to contribute in Stockholm then?
We hope to address some of these challenges, maybe provide practical solutions to them, and really tackle these things head on in an atmosphere, as we were saying before, where we have all of the stakeholders involved, and we're not just talking to other patient advocates, we're talking to the people who can deliver things, the clinicians, the researchers, but who need to know what our priorities are as patients, which include quality of life issues, include a whole range of other things such as the design of clinical trials. That's also an issue for all cancers, and particularly rare cancers as well. So we hope to tackle those things head on in a cooperative manner.
Can you tell me what you think are the really key messages you'd like to give, perhaps one at a time, about what you really think is going to come out of the Stockholm Congress, because it sounds exciting, it sounds as if it's a great leveller between patients and doctors, and that there really could be an edge gained in treatment. Galinda, how about this question of parents, first of all?
I hope it will be a big step forward on both sides, the medical side and the patient side, that we can talk to each other on the same level, hopefully.
Mm.
Well, I know for our rare cancer session, we'd like people to come because as time goes by, more and more perhaps of the common cancers will have more subtyping, and the common cancers will then become different rare cancers. So actually that's an issue that affects everybody, and so we'd like to see as many people as possible because of the ramifications of the future and rare cancers.
So your focus for the forthcoming Congress would be, what's the main advantage do you think people are going to get out of attending this whole track on patient advocacy ethics?
Honest, clear-cut information, an exchange between patient or the public and the doctor. Without that information, we cannot be either a compliant and cooperative patient, and we can help in our own diagnosis and we can help in our own treatment if we understand what it is doing. We can also get people going to the doctor early rather than late if they know what to look out for.
And Anita, the focus that you would like to see?
I would like if doctors learn that we are not in competition, that they benefit from the partnership, because really we can add so many things to their work, and we can support them as well as advocates. And if we inform our patients in the right manner, I think they will have a big benefit from this.
Can I just mention one more thing, Peter, about the actual people behind the patient track here? I think it's important to mention that these are the ECCO Patient Advisory Committee members, and we, as I said a minute ago, we've been working a long time on this conference as a group. I think we work very, very well together. We come from a lot of different types of backgrounds, and we represent a lot of patients across Europe. So it's the ECCO Patient Advisory Committee with the input of others. We had a clinician involved with this and a couple of other people who've put this program together. So we bring to it a variety of perspectives as well.
Do you have any more thoughts that you'd like to stress before we wind this up about what is going to happen in September and why everybody should go to it?
I hope that many patient advocates feel convinced to join this, because it's really important to see what's going on, not only on the treatment level, also on the political level, and what patient advocates can make a difference.
So everybody comes to Stockholm, please.
Yes, it'll be a fascinating, challenging and thought-provoking Congress.
And men too, Tom.
And of course men too.
Yes.
Yeah, we won't forget them.
Well, thank you all very much. It's been very enlightening, and I look forward very much to hearing the different tracks and taking part in them in Stockholm.